Welcome friends, I'm Dr. Rajsree Nambudripad, and today's video is all about dysbiosis. So what is dysbiosis? Well, an analogy is to think of our gut microbiome as a gut garden. We have trillions of different microorganisms and hundreds of different species that are all living together. When the healthy bacteria in our gut are balanced, we call this eubiosis. But if something affects the delicate balance of the bacteria in our gut and diminishes the growth of the good bacteria, this can allow the overgrowth of bad bacteria, which we call dysbiosis. Think of it as an overgrowth of weeds in your gut garden, and it can actually be caused by an overgrowth of certain bacterial species, yeast or fungal organisms, or even parasites. Every human being on this earth has a unique gut garden, and it's determined by numerous factors, including whether you were breastfed or bottle-fed, your diet, where you live in the world, your occupation, and even your stress levels. In today's video, you're going to learn why your unique gut microbiome plays a tremendous role in your overall health. Within our gut microbiome are three different types of bacteria. Commensal bacteria cohabit peacefully within us. Symbiotic bacteria help to keep us healthy, and pathogens are the ones that can actually do us harm. What's fascinating is although these microorganisms are located in your gut, they can have far-reaching consequences on your health. Research is now showing that dysbiosis is a potential root cause of numerous health conditions and diseases, including obesity, insulin resistance and diabetes, irritable bowel syndrome and inflammatory bowel disease, as well as autoimmune diseases like lupus and rheumatoid arthritis. Dysbiosis has also been linked to Alzheimer's dementia and even mood disorders such as anxiety, depression, addiction, and even schizophrenia. That's because we actually make 80% of our serotonin in the lining of our gut, which is why we often refer to the gut as the second brain. Dysbiosis has also been linked to heart disease and certain cancers. It can affect your immune system, leading to frequent infections like frequent colds, sinus infections, and even urinary tract infections. Dysbiosis is often evident on your skin, where it can cause acne, rosacea, psoriasis, and even fungal rashes. In addition, dysbiosis has been linked to chronic fatigue syndrome, fibromyalgia, as well as hormonal imbalances. So clearly, you want to address dysbiosis early so that it doesn't lead to any of these conditions. What are some clues that you might have dysbiosis? If you're struggling with bad breath, body odor, or foul gas, these could be signs that you have dysbiosis. Indigestion, bloating, and unexplained diarrhea are also signs of dysbiosis. Dysbiosis can also change the microbiome in other parts of your body, causing vaginal itching or anal itching. Dysbiosis can also alter your food preferences, leading to food cravings. It can also cause symptoms of fungal overgrowth, like dandruff on your scalp. Finally, brain fog and even insomnia could be signs of dysbiosis, because don't forget, the gut is the second brain, where you make 80% of your serotonin and melatonin, which is the sleep hormone in the lining of the gut. Now let's talk about what causes dysbiosis. Antibiotics and certain medications can cause dysbiosis. Coming up, I'll be explaining this in more detail. A lot of the foods present in the standard American diet, including refined sugar, alcohol, processed foods, and refined flours, can promote the growth of bad bacteria and yeast in the gut, causing dysbiosis. If you have constipation and slowed motility in your gut, this can allow the overgrowth of certain bad bacterial species, causing dysbiosis. Infections with certain bacteria like H. pylori in the stomach or a parasite can also cause dysbiosis. Finally, if you're under chronic stress, this leads to high cortisol levels, and this can actually change the types of bacteria that grow in your gut, leading to dysbiosis. Now let's talk about antibiotics. We all know that Alexander Fleming's discovery of penicillin in 1928 is still one of the greatest contributions to medicine. Unfortunately, these days antibiotics are often overprescribed for self-limited conditions, often which are caused by viruses which don't require antibiotics. The problem is that antibiotics not only kill the bad bacteria that's causing your infection, but they also kill a lot of good bacteria in your gut microbiome. Additionally, a lot of the bad bacteria in your gut microbiome can repopulate much more quickly than the good bacteria. Sometimes it can take up to months to years for your good bacteria to repopulate. And in certain cases, your microbiome only partially recovers, and it never goes back to the pre-antibiotic state. This is why antibiotics can be a big root cause of dysbiosis. Medications that can cause dysbiosis include acid-blocking medications like proton pump inhibitors because they change the pH of your stomach, which can allow bad bacteria and yeast to overpopulate. The synthetic hormones present in birth control pills can also change your gut microbiome, which is why some women get more frequent yeast infections when on birth control pills. Other medications that can cause dysbiosis include steroids, non-steroidal anti-inflammatory drugs like ibuprofen, as well as chemotherapy. Nurturing and maintaining the good bacteria in our gut is incredibly important because they play a pivotal role in keeping us healthy, and they have a lot of important jobs, like producing digestive enzymes, maintaining the integrity of our gut lining, crowding out other harmful bacteria, and training our immune system. These good bacteria also produce postbiotics, which are called short-chain fatty acids that influence our energy and metabolism. They can neutralize cancer-causing compounds and even produce vitamins like vitamin K and B vitamins. Our good bacteria also help to metabolize hormones and medications. And believe it or not, these good bacteria can even turn on and off certain genes. Millions of people are suffering from dysbiosis, but unfortunately, it's often undiagnosed. And that's because most of the common tests that are done by doctors don't pick up on dysbiosis. A lot of patients who come to see me have already had an ultrasound, a CT scan, as well as an endoscopy and colonoscopy, and they're still unaware that they have dysbiosis. In today's video, you'll learn why you're only as healthy as your gut bacteria, and why alterations in your gut microbiome could be the root cause of your symptoms and health conditions. Have you ever noticed that there's some people who never seem to get sick, while there's others who seem to get every cold that goes around? Our gut microbiome plays a strong role in our immune system, and unfortunately, those who are prescribed frequent antibiotics become more prone to getting sick due to the alterations in the gut microbiome. Your gut microbiome is influenced by so many different factors, beginning with the microbiome of your mother. For example, maternal obesity and dysbiosis can be passed on to the child and lead to metabolic disorders in the child. Next, how you are born influences the microbiome. Babies born by vaginal delivery are colonized with Lactobacillus, which is a good bacteria. In contrast, babies born by C-section are more likely to be colonized with Staphylococcus, which is a skin and hospital-associated bacteria more likely to be associated with illness and infection. This may be part of the reason why children born by C-section have higher rates of asthma, allergies, obesity, and type 1 diabetes. Next, whether you're breastfed or bottle-fed impacts the microbiome. Babies who are breastfed have higher levels of bifidobacterium in their gut, which is another good bacteria. Finally, antibiotic exposure early in life can have a big impact on the microbiome. For example, babies treated with antibiotics in the first year of life have a threefold increased risk of inflammatory bowel disease compared to children who don't receive antibiotics. Additionally, conditions like autism, asthma, allergies, and obesity have all been linked to antibiotic use during childhood. Now let's talk about the relationship between dysbiosis and leaky gut. The bacteria in our gut strongly influence the integrity of our intestinal lining through their production of postbiotics. If you have a lot of good bacteria in your gut microbiome, they will help to promote the normal tight junctions between the intestinal cells and a healthy gut barrier that keeps pathogens out of your bloodstream. In contrast, in dysbiosis, the bad bacteria break down the tight junctions between the intestinal cells, leading to leaky gut. This allows food particles and bacterial toxins called lipopolysaccharides to enter your bloodstream and cause systemic inflammation. This is how the bacteria in your gut can have far-reaching consequences, leading to autoimmune diseases, obesity, diabetes, fatty liver disease, cancers, dementia, and even heart disease. So healing dysbiosis is a big part of treating leaky gut. Please check out my video on leaky gut to learn more about this topic. Now let's talk about obesity. It's a growing epidemic affecting a third of the US population. Dysbiosis is strongly linked to obesity, and we see lower levels of Bacteroidetes bacteria and higher levels of Firmicutes bacteria. This causes a higher release of bacterial toxins called lipopolysaccharides into the circulation, leading to chronic low-grade inflammation. This lower ratio of the Bacteroidetes to Firmicutes bacteria also allow these individuals to extract more calories from their food because the bacteria produce more enzymes for the breakdown of dietary polysaccharides. Obese individuals also have a lower abundance of good bacteria, which are Bifidobacterium and Lactobacillus. This means they also have lower postbiotics being produced by these good bacteria, which influence metabolism and satiety. Obesity is also associated with a lower abundance of another good bacteria called Akkermansia mucinophilia. Akkermansia is a bacteria that lives in the mucus layer of our intestines, and it influences the production of a hormone called GLP-1, which regulates satiety. Unfortunately, obese individuals have less Akkermansia, meaning less production of GLP-1 and less control of their appetite. Now, did you know that certain probiotics can actually help your weight? There was a study done in mice where one group of mice were given a probiotic species called Lactobacillus paracasei. What's fascinating is this group of mice did not gain any weight when fed a high-fat diet. The good news is our probiotic 100 billion actually contains this specific strain, Lactobacillus paracasei. And our probiotic 225 billion contains a similar strain called Lactobacillus casei. This is why I always recommend a high-quality probiotic to my patients looking to improve their weight and metabolism. Moving on, let's talk about how dysbiosis can affect your hormones. There's a condition called estrogen dominance, where women have high levels of estrogen and they often have a pear-shaped body habitus because they carry their weight in their breasts, hips, and thighs. Estrogen dominance can cause a lot of symptoms, including PMS, heavy periods, fibroids, breast cysts, endometriosis, and even breast cancer. We actually have a part of our gut microbiome that metabolizes estrogens, and it's often referred to as the estrobolome. Estrogen dominance is often associated with dysbiosis, where there's an overgrowth of bad bacteria in the gut which produce an enzyme called beta-glucuronidase. This enzyme recycles estrogens and other toxins back into the circulation. This is why addressing dysbiosis is a big part of treating estrogen dominance. If you're struggling with constipation, this can also lead to dysbiosis because the stagnant stool can allow bad bacteria to grow. In fact, these bacteria can actually promote the recycling of estrogens and toxins back into circulation. We call this enterohepatic recirculation. This is why having healthy bowel movements every day is essential for good health. I have a whole video on the topic of estrogen dominance, so if you'd like to learn more, please check it out. Did you know that dysbiosis in your gut can influence infections in other parts of your body? Let's take an example of a person who has an overgrowth with a bacteria called Klebsiella pneumonia in their gut microbiome. If they come down with pneumonia or a urinary tract infection, we find the same exact species of Klebsiella in their lungs and bladder. So if you're struggling with recurrent infections, it's important to address your gut microbiome. We've talked a lot about bad bacteria, but now let's switch gears and talk about yeast overgrowth. Normally, the good bacteria in our gut help to check fungal overgrowth. But if something causes the good bacteria to go down, this is when we can see yeast overpopulate in the gut microbiome. Symptoms of yeast and fungal overgrowth are really common and include thrush, vaginal yeast infections, dandruff, and toenail fungus. It can also cause outward skin infections like ringworm and tinea versicolor. One of the biggest causes of dysbiosis with yeast is antibiotics. For example, in women, antibiotics can actually kill some of the good vaginal Lactobacillus bacteria. Unfortunately, this is why some women experience vaginal yeast infections soon after taking antibiotics. This is why it's so important to take a high-quality, broad-spectrum probiotic whenever you're on antibiotics to help protect your gut microbiome. Later in this video, I'm going to provide a lot more guidance on probiotics, so stay tuned. To learn more about fungus and yeast overgrowth in the gut microbiome, I have a whole video called Candida and SIBO, so please check it out. Now let's talk about the connection between dysbiosis and colon cancer. Colon cancer has been associated with an increased abundance of Firmicutes and Fusobacteria. In fact, Fusobacteria constitute about 10% of the bacteria in colon cancer patients, but less than 0.1% in healthy individuals. This dysbiosis increases epithelial permeability, which allows the invasion of microbes into cells. Unfortunately, this activates the proliferation of cancer cells. A diet high in red meat can also cause dysbiosis that can increase the risk of colon cancer. That's because it promotes the growth of sulfate-reducing bacteria, which produce hydrogen sulfide and reduce the formation of protective mucus in the colon. The hydrogen sulfide also inhibits methylation of DNA and increases production of reactive oxygen species. This is the domino effect of dysbiosis that can cause colon cancer. Did you know that food sensitivities and intolerances are also linked to dysbiosis? In fact, food sensitivities have reached alarming rates, affecting more than a quarter of the US population. The bacteria in our gut produce key enzymes that are needed to properly digest food. Any antibiotic exposure has the potential to cause gluten sensitivity by altering the gut microbiome and increasing permeability of the gut, causing leaky gut. Dysbiosis can also lead to dairy intolerance, as well as fructose intolerance, which leads to the inability to digest fruit. It can also cause histamine intolerance, which is found in fermented foods like sauerkraut, as well as oxalate intolerance, which is a compound found in spinach and chard. Finally, dysbiosis can cause numerous carbohydrate intolerances. Histamine intolerance is a growing problem, and it can cause symptoms throughout the body. In the brain, it can cause anxiety, insomnia, and migraine headaches. In the stomach, it can cause acid reflux or heartburn. In the nose, it can cause sneezing and sinus congestion. On the skin, it can cause itching or hives. It can also cause swelling in any part of the body. In the lungs, it can cause wheezing or difficulty breathing. And in the heart, it can cause palpitations, rapid heart rate, or even high blood pressure. Dysbiosis is a big root cause of histamine intolerance. The overgrown bad bacteria end up eating an enzyme called diamine oxidase, also known as DAO, which normally breaks down histamines in the gut. These bad bacteria also increase production of histamines. Histamine intolerance is associated with an overgrowth of bacteria like Morganella, Hafnia, Proteus, Enterobacter, Enterococcus, Citrobacter, Pseudomonas, and Lactobacillus ceramneri. These bacteria produce an enzyme called histidine decarboxylase, which convert the amino acid histidine into histamine. I have a whole video that explains histamine intolerance in depth, as well as how to overcome this condition by healing your gut, so please check it out. Next, dysbiosis can also cause carbohydrate intolerance, where people become afraid to eat certain types of foods, like bread, because they know it'll cause them tremendous bloating. Often, this is due to dysbiosis in the small intestine, called small intestine bacterial overgrowth, or SIBO. Normally, our small intestine does not have a lot of bacteria, and the job of the small intestine is to absorb nutrients from our food. Most of the bacteria is located in the large intestine, or colon. In SIBO, the bacteria populate the small intestine where they're not supposed to be, and they eat up the brush border enzymes that normally help to digest foods. This is why SIBO can cause numerous food intolerances. The SIBO bacteria also produce gas in the small intestine, which can cause painful bloating and symptoms of IBS. There's 3 different types of SIBO: hydrogen, methane, or hydrogen sulfide. In methane SIBO, there's an overgrowth of an ancient form of bacteria called archaea, called Methanobrevibacter smithii. It can actually also be present in the colon, which is why the new terminology is intestinal methanogen overgrowth. What's interesting is that having dysbiosis with M. smithii has been associated with weight gain and constipation. In addition, dysbiosis with several bacteria has been observed in patients with SIBO and IBS. This includes Enterococcus, E. coli, and Klebsiella. To learn more about SIBO, please check out my 2 videos on this condition. The first is an overview of the condition, and the second covers my herbal protocol to overcome SIBO. Now let's move on and talk about oxalate intolerance. Oxalates are a compound that are found in certain foods, like spinach and chard, almonds, beets, and potatoes. In our gut microbiome, we have a key bacterial species that's dedicated to oxalate metabolism, and it's called Oxalobacter. Unfortunately, the absence of Oxalobacter is seen more commonly in the United States, and it's associated with a less diverse gut microbiome and with antibiotic use. People who are missing this bacteria in their gut microbiome will not be able to properly metabolize oxalates, and the high oxalates can end up in their urine, causing kidney stones. Unfortunately, a lot of people have been blaming high oxalate foods and have resorted to a carnivore diet where they're only eating meat. However, it's important to recognize that oxalate intolerance actually stems from dysbiosis in the gut and an absence of Oxalobacter. The good news is that probiotics with Lactobacillus and Bifidobacterium can also help in breaking down oxalates. Moving on to more life-threatening conditions, let's talk about C. diff colitis. This is a severe form of colonic dysbiosis caused by the overgrowth of a spore-forming bacteria called Clostridioides difficile. Interestingly, this bacteria actually colonizes up to 15% of healthy adults, but it's not until it overgrows that it can cause life-threatening diarrhea. The number 1 cause of C. diff colitis is antibiotics. That's because it wipes out good bacteria, allowing the C. diff to overpopulate. What's interesting is there are cases of refractory C. diff where the bacteria becomes resistant to a lot of antibiotics. So the traditional antibiotic protocol only has a 30% efficacy rate, whereas fecal transplant has a 90% success rate. A fecal transplant is where they take stool from a healthy donor and introduce it into the patient either by colonoscopy or an enema. Once again, fecal transplant can be life-saving in refractory C. diff colitis. This is a powerful example showing how good bacteria can push out bad bacteria and resolve a life-threatening infection. Now that we've talked about dysbiosis in the colon and small intestine, let's talk about dysbiosis in the stomach. There's a bacteria that can infect the stomach called H. pylori. H. pylori can cause pain and burning in the stomach because it can cause gastritis, which is inflammation, as well as stomach ulcers. Sometimes H. pylori can last for decades in the stomach, causing chronic inflammation. Unfortunately, this can activate the immune response and cause cellular changes that can lead to gastric cancer. So this is another great example of dysbiosis being a risk factor for cancer. To learn more about H. pylori, please watch my video on this topic, which also covers my natural herbal protocol for treating H. pylori. Finally, dysbiosis can also be caused by infections with parasites and worms. You can contract a parasite by consuming contaminated water or meat, or by being exposed to infected animals. This is often more common when traveling abroad or going camping. There are numerous different types of parasites, but some of the common ones we see in the United States include Giardia and Blastocystis. Having a strong and robust microbiome can actually help protect you from parasite infections. And there's a specific strain of probiotic called Saccharomyces boulardii that's also been shown to help prevent parasite infections. And I'm going to talk more about this later in this video. So now you might be wondering, how can I test for dysbiosis? Great question. Often you can make a diagnosis based on your clinical symptoms, but it's helpful to confirm it with a stool microbiome test or a SIBO breath test. The stool microbiome test provides an extensive analysis of the bacteria in your gut. It shows if there's any overgrowth of a bad bacteria or yeast to suggest dysbiosis. It checks for parasites and H. pylori, and it also checks inflammation markers for leaky gut. Additionally, it tells us how well the bacteria are producing postbiotics, which are short-chain fatty acids like butyrate. It also reports the activity of the beta-glucuronidase enzyme. Remember, this is the enzyme that recycles toxins and estrogens from your gut. Now let's go over my protocol for treating dysbiosis. The first step is to clean up your diet, because what you eat is one of the most influential factors for your gut microbiome. Then we want to recolonize your microbiome with good bacteria by introducing probiotics. We can kill the bad bacteria or yeast by using natural herbal antimicrobials. Taking digestive enzymes can help improve food toleration. Finally, we want to focus on healing any gut inflammation. First, we want to eliminate from your diet all the foods that are potentially feeding all the bad bacteria and yeast in your gut microbiome. So you want to eliminate refined sugar, artificial sweeteners, and high fructose corn syrup, which is often found in sodas. It's best to minimize alcohol for two reasons. First, alcohol turns into sugar, so it can feed bad bacteria and yeast in your gut. Second, alcohol is bactericidal, meaning it can kill some of the good bacteria in your gut. You also want to eliminate all processed foods, refined oils, and trans fats. It's best to eat organic as much as possible to avoid pesticides and genetically modified foods which can harm the gut microbiome. Finally, you'll want to avoid conventional dairy products which may have hormones, as well as conventionally raised chicken and meat which may be treated with antibiotics. In order to improve the health of your gut microbiome, you want to make your diet as rich in whole plant foods as possible. This means eating a wide variety of colorful vegetables and fruit. These foods are loaded in polyphenols and fiber that help to feed all the good bacteria and increase the diversity of your gut microbiome. Now, some of you may be wondering, why do vegetables always make me bloated? Well, this can actually be a symptom of dysbiosis, particularly small intestine bacterial overgrowth, or SIBO. I have a whole video that outlines my natural herbal protocol for treating SIBO. This protocol can help you to overcome bloating and symptoms of IBS, and it works for both SIBO and dysbiosis. Quality proteins to include in your diet include wild salmon, organic chicken, pasture-raised eggs, grass-fed meat, as well as lentils, beans, and seeds. Healthy fats include avocados, olive oil, nuts, and fatty fish like sardines. Fermented foods are loaded in natural probiotics, and they include miso soup, yogurt, kombucha, kimchi, tempeh, sauerkraut, and kefir. However, these foods are very high in histamines, so if you're suffering from histamine intolerance, you may need to avoid these foods while you're healing your gut, and then later you can gradually reintroduce them back into your diet. I want to emphasize that your diet can make all the difference in overcoming dysbiosis. By eating a wide range of colorful plant foods, you're feeding the good bacteria in your gut and promoting a healthy and diverse gut microbiome. The next step is to introduce probiotics. You want to use a high-potency, broad-spectrum probiotic, like our probiotic 100 billion or our probiotic 225 billion, which have over 5 strains of Lactobacillus and Bifidobacterium. These good bacteria help to produce healthy postbiotics, and they help to crowd out bad bacteria from growing in your gut. Saccharomyces boulardii is another important probiotic strain that's actually a probiotic yeast. It's a good yeast that pushes other bad yeast out of the gut microbiome, so it has antifungal properties as well as antiparasitic properties. Saccharomyces boulardii has also been shown to be effective in improving symptoms of irritable bowel syndrome. One of the most powerful tools we have in treating dysbiosis is herbal antimicrobials. This includes the combination of berberine, oregano oil, and alicidin, which comes from garlic. This combination of herbs is effective in treating dysbiosis, SIBO, CFO, which is small intestine fungal overgrowth, as well as candida and yeast overgrowth. The other benefit of these herbs is that they have anti-inflammatory properties. Next, we have digestive enzymes, which can really help anyone suffering from gut symptoms. Digestive enzymes work to break down your food better, so it can really help improve food toleration, reduce bloating, and improve toleration of the herbal antimicrobials. Finally, it's important to heal gut inflammation, and we can use L-glutamine powder or IgG GARD. L-glutamine is the amino acid food for the enterocytes, which are the cells lining your intestines, so it can help seal up the tight junctions and heal any leaky gut. IgG GARD is immunoglobulins that work to rapidly heal inflammation in the gut, bind toxins and bad microbes in the gut, as well as improve toleration of food. Next, exercise can promote many positive changes in your gut microbiome. In fact, they've studied the stool of athletes, and it shows more bacteria and greater diversity. Exercise also helps to promote healthy gut motility. Spending time in nature, where you can breathe in fresh air, enjoy a little sunshine, and interact with plants and animals is also good for your gut microbiome. In order to maintain healthy bacteria on your skin microbiome and oral microbiome, you want to avoid over-sanitizing. Avoid soaps which contain sodium lauryl sulfate, which is a harsh detergent. You only want to use hand sanitizer when necessary, and avoid using mouthwashes that contain alcohol. Now let me introduce you to one of my patients, named Daniel. Daniel is a 28-year-old man who was suffering from foul gas and irregular bowels. When I examined him, I noticed he had psoriasis on his elbows and dandruff on his scalp. All of this suggested dysbiosis, and a stool microbiome test confirmed that he had an overgrowth of Klebsiella and Candida. Unfortunately, Daniel was drinking a lot of soda and eating a lot of fast food and processed foods. So I helped Daniel to clean up his diet and treated him with probiotics and herbal antimicrobials. When I saw Daniel 3 months later, he looked like a different person. He was now having regular bowel movements, his skin had cleared up, and he had so much more energy. This is how powerful it can be to treat dysbiosis. Let's review the key points from today's video. We're only as healthy as our gut bacteria, so our goal is to have a healthy and diverse gut garden. Dysbiosis in the gut is linked to most diseases. You want to be cautious with your use of antibiotics because it can sometimes lead to dysbiosis and yeast overgrowth. Food intolerances can actually be a symptom of dysbiosis. Our diet is a key factor in maintaining a healthy gut microbiome, so you want to focus on what you should be eating to grow a healthy gut garden. The good news is dysbiosis is very treatable with probiotics and herbal antimicrobials. Thanks so much for watching this video. If you enjoyed it, please give it a thumbs up and subscribe to my channel. I always look forward to hearing from you, so please post your questions and comments below. Thank you again, and have a wonderful day.